Good morning, everyone, on this bright, well, not so bright, actually. Just looked outside the window. It's not desperately bright this morning, but I think the mist that we have here in West Somerset may clear up over the next hour or so, and hopefully we'll see some sunshine today. But hey, we're going to bring you lots of sunshine on this broadcast today from the Patients Association, which is about helping patients to prepare. We've been doing lots of work over the last few months, and Sarah Tilsed from the association is going to tell you a little bit more about that in a few moments' time, about how we can become, as patients, become more prepared to take part in conversations with health and care teams. That's what we're all about today. So if you're thinking that you're in a different webinar to that, please hop off now, but otherwise welcome. And let's have a fabulous time together over the next hour. My name's Alf Collins. I am a trustee of the Patients Association. It's my pleasure and privilege to host this webinar today. I've got a number of people joining in, and we'll all introduce each other in a few moments' time. I was also a doctor by training, so I come with that as well. Let me tell you a little bit more about the webinar before we jump in. It's going to be recorded and it's going to be uploaded to our website. I want to please, there's quite a lot of you. I think there's over 100 of you, which is fantastic, on the call today. Please use the chat to introduce yourselves to each other. And when you want to ask questions, please use the Q&A function on Zoom. We can't facilitate questions from the chat, but we'll do our best. We're going to come to a kind of a more open session after about 35, 40 minutes where we can all join in. Just to let you know, the closed captions function's been enabled, and we'd ask you please not to take photographs or screenshots of the speakers. Next slide, Holly, please. Our panelists, we're going to introduce ourselves in more detail in a few moments' time. That's me at the top for a change, usually at the bottom. Yeah, it is a pleasure to be here. We've got the wonderful Sarah, who I think you can also see on screen, who's the head of partnerships and involvement at the Patients Association. And Sarah's going to tell you a little bit more about what we've been doing in a moment or so. We've got the wonderful Adam, a patient. He's more than a patient, he's all sorts of things, as is Curie, a patient, and they're going to tell you a little bit more about themselves in a few moments' time. Next slide, please. And what I think I'll do is I'll hand over to Sarah to tell you a bit more about what we've been doing in the association. Sarah.
Thank you, Alf. So as Alf has so eloquently said, this webinar is all about being prepared. And we recently did some work that was funded by GSK, which was all around being prepared. As we know, millions of patients continue to be waiting for care, and therefore it's so important that patients are prepared for when they finally get their appointment. And obviously every patient's journey is unique, but we are seeing repeated issues across all aspects of our work that mean that patients are really losing out because they might not know what to expect when they finally get to the appointment. They don't know what to ask or what might be asked of them. And this applies before, during, and after patients have engaged with health and care services. So the Patient Association really do believe that helping patients prepare for these issues can make a huge impact for both of the patient and for the health system. And I think it's particularly important for those who are experiencing health inequalities. They really know what to expect. And as I said, we wanted to provide patients with the tools that they need so that they are prepared. And as part of this work, and you can see some lovely screenshots there of the animation and the guide, we did a literature review. So really looked into other organisations and our own research into patient preparedness. And we ran a focus group with some patients as well. just to really better understand the causes and consequences of a lack of patient preparedness, as well as the benefits of being prepared. And as I said, there was a guide created and an animation both on our website, and these are both to support patients to be better prepared. So what can they do to prevent things going wrong, and think about steps that they can take at each stage of their journey through the health and care system. So I just wanted to let you know about those new resources of ours, and that is kind of the basis for this webinar to be taking place. And now I think we're going to take the slides down so that we can see everybody's faces and we can actually hear from Curie and Adam. So thank you
so much, Sarah. So we wouldn't have expected any of you to necessarily have read the resources, but we're going to be doing today is talking about why patient preparedness is important. But before we launch into that, why don't we introduce ourselves? Curie, why don't you introduce yourself first?
Good morning, everyone. My name is Curie, and I'm a patient, and I'm also a lived experience practitioner. And I'm here today to bring a voice to the table from the patient's experiences. Thank you.
Curie, could you just tell me a little bit, or tell us a little bit more about what you mean by a lived experience practitioner?
So it means that I share the experiences that I've had in my journey in life, and I use that to enrich research. So I bring a voice. For example, I have chronic illnesses, and I use that to help shape and inform research by giving them that experience of what it's like to have to live with certain symptoms of a disease.
Right. Thank you very much. Thank you, Curie. Adam.
Good morning, guys. Thanks for having me this morning. My name's Adam McDonald, and I'm a patient, and I'm going to be, I'm coming from lived experience, my journey as a trans male, initially going to a GP surgeon and being referred, and I use my lived experience to help mentor and educate others. And yeah.
Thank you, Adam. Welcome. It's lovely to have you here. Sarah, just want to briefly introduce yourself, even though I think you have said a little bit about yourself, a bit more maybe, Sarah.
Yes, thank you. I'm Sarah Tilsed, Head of Partnerships and Involvement at the Patients Association, and that sees me kind of getting involved in lots of different exciting aspects of our charity. So it might be speaking to a charity one day and trying to build a relationship with them, or it might be running a focus group with people like Curie and Adam to find out their experiences of a particular topic. I also manage our helpline team as well. So we have a free helpline for those of you who are not aware of that, and anyone can contact our free phone helpline at any time. But today's not about me, so I'll shut up now and you can carry on.
Thank you, Sarah. And I'll come to Curie first. Why is it important? Why is it important that we prepare for the conversations and encounters that we're going to have with health or care professionals?
I think it's important to be prepared, because when we visit a healthcare professionals, for instance, your GP, one, there's limited time, and secondly, so as to be able to get as much information within that short period of time to the GP, so he can make the best decisions regarding your healthcare for you. So it's really important to be prepared. So, and this could include just preparing for the questions that you want to ask your GP.
So what I think I've heard you say is it's important that they know something about you. not just your symptoms or your condition, but also part of preparation is having a list of questions that you want to ask them. When you have that list of questions, is it one question or 3 or 5 or 10? What's your experience, Curie?
Well, it would relate to, so in my case, it would related to things like, so I was going to have a CT scan, and I wanted to know, for instance, about radiation, about the risks, about whether I could have it done locally, whether there would be side effects, about the injection that would be given, things like that. I just felt that I needed that preparation. So psychologically, I could go in to that for that scan feeling adequately informed and having that scan with an informed consent. So I had that knowledge already. So that's an example of being prepared.
It's a great example. That's a really great example. Something about, for me, what's coming through there is actually kind of, in a sense, kind of feeling confident. You kind of know what's gonna happen. Adam, what's your experience? Why is it important for you that you prepare?
Yeah. When I first went to the GP to speak to him about me feeling more male, I didn't really have a word for that. I wasn't brought up in an environment that there were transgender education or anything, but I also came along with complex needs. I had more than one. I was dealing with that, and my mental health wasn't good, and I was suffering from alcoholism as well. So when I was in front of the GP, it was really difficult to articulate myself to the GP. And in reflection, if I had the support or sat down and kind of written a list of what my needs were before I went in to speak to the GP. But at the same time, way back then, the GP, he was quite honest about it. He says, I don't really know the pathway regarding being transgender and stuff. So that was a bit of a stumbling block for me. And so I went away and I got as much information as I could about the pathway, getting treatment or gender dysphoria and whatnot. And I came back, and this is after a few years. And luckily I got a GP who was willing to listen to me, and he says, bring in the information, Adam, and let me read it over, and then get me the useful numbers and whatnot. And I did. I contacted an organisation. I got all the useful numbers for the GP, and by his word, he had contacted these organisations, and he had got the information he needed to be able to help me move forward, which was fantastic. And I managed to get a referral to Leeds Gender Clinic. It was fantastic, and he just took the time out to understand what I was kind of going through, and it was amazing because we were working together then, as opposed to me just sitting in front of him expecting him to come out with all the answers, sort of thing. Yeah, it's been quite a long
Great
journey.
story, Adam. That's such a story of partnership working between a healthcare professional and a patient. And I'm curious, actually, do you think your GP's always like that? Is he? I think you said it was a he.
Yeah, when I first went in front of the GP, I've lived quite I've moved around a lot. I don't keep in touch with my family. So I've been kind of flying solo since I was 16. And it was in Lancashire area, and the GP was just, I felt that GP I wasn't getting anywhere, and I moved again. And it wasn't until I moved about 5 years ago to Newcastle Way, and I got that GP, and he was the one that took the time out to read and also take into consideration my complex needs, that I was an alcoholic, and I was suffering from complex PTSD or PTSD, and all these complex, and the doctor was helping me prioritize and work through these complex needs. And it was wonderful, and it was like, oh, the weight on my shoulders was taken and it was shared, and it just started my journey in a positive way. I was able to access support in dealing with my alcoholism and dealing with my mental health, and then working with the gender clinic in Leeds. And the best thing I would say is to be as transparent as possible when speaking to health professionals and GPs, because they've been able to help me, as opposed to, you know, like worrying that if I tell them I'm an alcoholic, I'm not going to get any help with my gender dysphoria, and stuff like that. So being as honest you can, so to get the treatment, yeah.
And you know, it's really fascinating hearing you talk about that relationship with your GP. I remember many years ago someone describing this, you know, when relationships work, it's like you're dancing together, you know, everything's
Yes.
effortless and coordinated and it's working beautifully, and your description just wonderfully vivid.
It really empowered me as well, because through these brick walls, through these like frustrating and through the desperation, I've become my own expert, and it really empowered me. And so my conversations with the GP is completely different. We're having a conversation, and the GP's learning so much from me, and I'm like, wow, the GP's learning from me, and I'm having this, you know, two-way kind of conversation. And so I'm walking away from that appointment feeling empowered, and I'm not worried about the next appointment. I'm not feeling that I haven't been heard, and I'm enthusiastic about what we've discussed, and I'm more engaged. And you know, and it's kind of like helping me take ownership of also my mental health and my alcoholism and my general health as well. So yeah, that's helped me.
It's lovely, Adam. Thank you. So I
Thank
just
you.
want to bring you in here. Is there anything you wanted to add with regard to, you know, why this is important for patients? I'm going to come to you again in a moment, Curie.
I think, as I said, we hear every day from patients coming to us with issues, and that can be issues around anything, whether it's accessing services, the treatment that they've had with a healthcare professional, you know, a whole range of topics. And I think perhaps if patients are prepared for whatever it might be that they're going to, in whatever if it's primary, if it's secondary, if it's community, then perhaps some of the issues that they're reporting might not be taking place. So I think if patients are prepared, then hopefully they're experiencing fewer issues than they are. And, you know, we've got a whole society of patients that feel more confident.
Right.
You know, they can have these better experiences with healthcare professionals and themselves, as Adam was saying. You might learn a lot about yourself, your condition, and actually can teach, like the GP, for example, which I think is absolutely brilliant.
Yeah, isn't it? And we've talked over the years about people moving from being a passive recipient of care to being an active participant in care processes. And Kira, I just want to kind of look into this in a bit more detail. You talked about your example of having a CT scan and wanted to know an awful lot about it. Was there a downside to that in the conversations you were having with the team before the CT scan, or did they just very openly and honestly and simply just answer all of your questions?
I found them to be open and, you know, willing to allay my fears about having a CT scan. And as well as a CT scan, I have also had an endoscopy and a colonoscopy, in which I even needed to ask more questions. But even on the day, I still had the opportunity to ask questions, and so that's with the actual consultant as well, the person who will actually be performing those procedures to allay my fears. And well, I was asleep for the endoscopy and colonoscopy, partially asleep because I woke up in the middle of it. They only put you to sleep a little bit. And so I woke up, and on the monitor, you can see inside your body. And inside and down, you know, the inside as well. And I can ask questions as well. So what was that? You know, and they would tell me. So whilst the procedure was going on, so it made it really pleasant, the whole procedure, being able to see live on the screen what they were doing. And it wasn't a problem for them to even answer my questions whilst the procedure was being done. And I felt that was really nice.
Such a cool example. I mean,
Yeah.
and I.
Alf is having some technical issues there. Can you hear us, Alf? I'll fill in, I think, until Alf finds his way back. Obviously, I can't guess what Alf was about to say, but Curie, it was clearly something about your wonderful experience. And I think, you know, they're clearly prepared as well. They know that you're about to ask some questions. So I think it is a two-way thing, isn't it? It's about healthcare professionals being prepared for patients, and to know that patients may come to them, they may ask questions. So I guess for the healthcare professional, actually, it would be good to hear outside of this, what can healthcare professionals be doing to help you? It is a two-way thing. It is that partnership that was either Alf or one of you that spoke of earlier. And I think one thing is that I was thinking about this, which, and as I said, I'll come back to Alf to talk about the healthcare professional side of things. But do you think that actually there might be some, I don't know what word to use, kind of maybe some downsides of being prepared? Maybe not for the peer review, because it does sound like you've had a good experience, but overall, we've been saying about how brilliant it is, and I've got some examples if you can't think of them. But from your side, do you think there might be any downside of patients being prepared?
Well, there are times I've been to my GP, not even my consultant, sorry. I remember when I was pregnant, so when I was having my maternity journey, something came up on the scan. So they could see that my son would be born with congenital disease. And I had done some research about different treatment options. So the treatment would need to start whilst I'm still antenatal, before I'd given birth. And it was what I had chosen, I had done research from the States, and it was a rare procedure, rarely done in the UK. And my consultant had actually written a paper about it, and he had written against intervention. But as a mother, and I had done the research, and so when I came to him and presented this particular treatment option, he was surprised, and he asked me how I knew about it. And I said, I had done research on the internet, and I had also done research on him, my consultant, as well, and which I told him. I said, you know, you'd written a paper against it. But I did convince him to begin the interventions, to begin the treatment. And my son is alive today, you know.
Fantastic.
But I think for doctors and consultants, they can be spooked, they can be surprised that a patient would go and do a lot of research.
Yeah, but see, for you being prepared, there was a brilliant outcome, even though the healthcare professional, it didn't work for them as well. It really, really worked for you, and that's a brilliant story. And Adam, I think I saw you going to say something. Go for it.
Yeah. They have experienced a negative in regards to communication Every 6 months, I think I get my bloods taken to check my testosterone levels. And I moved. I've lived quite a transient life, so I moved. So I was at a different GP surgery, and the results came through, and the GP was looking at the wrong the testosterone level. He was looking at the female level, so he stopped my testosterone, and he should have been looking at the other levels. And I spoken to him, and I was like, my levels should be such and such, and why have you stopped my testosterone? And I had to go out and seek advice outside. Luckily, I've got a trans brother, and he's really on the ball, and he gave me the ranges, but it took me about 4 conversations with this GP. As a consequence, I didn't have testosterone for 3 months. And for me, that put me through, it was hell. I thought I was going to have a period again, and my emotions were all over the place, just by simply the GP not taking time to understand the reading, or for whatever reason. And through that, I've learned to become my own expert. So, and also with that, I don't take for granted the communication. It's not always good with the communication with the GP to the whatever health clinician. So having that kind of research and that knowledge, it's always good too, because don't take for granted that they all communicate together.
And these are such two, both of you brought up such important points. So Curie's was actually the healthcare professional is not always the expert. Curie was the expert here. And Adam, you brought up about communication, which is what we hear every single day from patients, just how communication needs to be improved. And for me, I think if communication could be improved in the health sector, the world would be a better place for the healthcare professionals, the patients. So that is such a good point there, Adam.
Yeah, I think it's a two-way traffic. I think the health professionals' trust to the patient as well maybe needs to be a wee bit more better as well, you know. Yeah, thank you.
Yeah. And Curie, did I say yep?
Yeah, I just wanted to mention that I think in my case, there was only one option presented, and that was termination of pregnancy, TOP. But because I was able to do my own research, I was able to bring options to the table, you know, and I'm really grateful that despite writing a paper against interventions, that I was able to convince him to, give me to perform that procedure. And it ended up, so it wasn't just, so he actually used me to teach. So that procedure, he taught other student doctors that procedure. And I'm glad that I had a successful live birth.
So he's learned from you. You've taught healthcare professionals, and Alf is back, and I will bring you back in, Alf. But there's just one thing that I want to mention before we move on. And one of the examples I thought about is if there's any downsides or whatever the word is that we're looking for here in terms of being prepared, is that, and I think actually both of you have shown good examples of this, is the whole issue of what about health inequalities? Those actually don't know how to be prepared. They don't have the time, or maybe English isn't their first language, whatever it might be, the reasons for them not being able to prepare as well as the peer review, and actually they might not get as good a care as you. And so I think that's just something to be aware of, is how can we support those patients to be better prepared, which Alf, now I can bring you back in. We were talking about actually how healthcare professionals are not always the experts, and also what can healthcare professionals do to partner with patients, so it's not just the patient having to do all of the work.
Right, thank you, and apologies everyone. Best laid plans and everything. Down goes the internet, but it's back on, which is fantastic. It's lovely to be back here. Just picking up on that, I certainly a lot of my career I spent in in this space. And you know, we know that if clinicians are trained to have these sorts of conversations and patients are prepared, then it can be like a wonderful dance that we talked about 20 minutes ago. It's not always like a wonderful dance, but if clinicians are trained, it really can make a big difference to that conversation that we have. Picking up on that question about what tips can we give to people who are perhaps not as confident as you, Curie, you Adam, to have these conversations. What tips would you have to start? There may be a few people on the call who are feeling, well, yeah, I kind of get it, but I'm just not. I just get so anxious. I don't really quite know where to start. What, Alan? Could I start with you? What tips would you have, Adam?
Oh, sorry, I do apologize.
That's okay.
For me, when I'm speaking to my friends or I'm mentoring someone, I always say, you know, you can, if you are struggling to articulate yourself or advocate yourself to the doctor or to the GP, is to write it down. And then when you're in your appointment, hand a piece of paper over and let the doctor read it. Because it could be like for me, when I get really nervous and I get anxious, I really struggle to articulate myself, to get the words out. So if I've written it all down, I can hand it to the GP and the GP can read it and we can take it from there, because then the GP knows obviously what I'm trying to articulate to them, what my needs are, but also appointments as well. I've learned through practice the difference between when to phone up, what kind of appointment suits what. Sometimes you need more than one condition that you need to discuss. So what I would do is have a telephone appointment, and kind of adjust the appointments to what my needs are.
Brilliant, fantastic.
Yeah, I would also, if I had my time, what I would have liked is some sort of buddy, some sort of person kind of helping me, some sort of extra support through my journey, through my transgender journey, whether it be a health champion or, you know, someone like that can help me, kind of support me throughout my journey, sort of thing, instead of doing it all for myself, because it's really difficult when you don't have the support of family and friends. Sometimes it's really frustrating, and when you've got someone there that can help support you, specifically for your needs, you know, it makes a massive difference.
So just to be clear, that's not just someone who's with you on your journey in between appointments. It's someone who's with you on your journey in appointments. Is that
Yeah, when I came out the army, I trained as a health trainer. I really loved the idea. I loved the being able to be someone that can support someone that's going through, whether it be stop smoking or you know, want to lose weight, and just being there as a support that they can contact, finding information for them, helping them, you know, even going along to appointments and stuff like that. You know, the bridging little things, these important things that stop people going to appointments, that stop people picking up that phone and accessing the support. You understand what I mean?
completely, perfectly? So, I'm Curie, I'll come to you for some tips in a moment. What I'm hearing from you, Adam, is write down a list of questions. Think about the format of the appointment. Is it going to be a phone call? Is it going to be Zoom? I'd
Yes.
say not Zoom because it sometimes lets you down. Sorry. But also this idea of advocacy and peer support are great tips. And any thoughts from you, Curie?
So those are really important points that Adam has raised. But just to buttress or add a viewpoint, my neighbor doesn't speak, well, English isn't her first language, and she has really complex health needs. And usually she'll ask me to help her to make phone calls, to read appointment letters and things like that. So one thing I just want to add is community is a really good resource to use to help if, for instance, English isn't your first language, or you need that additional support. You're not very literate. You can't really read things, just to help address health inequalities. Look within your sphere of influence. Maybe it could be a leader in your community. It could be a neighbor, as in my case. I help my neighbor a lot with appointments, and she has a lot of appointments. And just things like even booking transportation for her to go to the hospital. And sometimes depends on the hospital that she's going to go. She doesn't always, she goes to different ones for her different needs, even out of borough hospitals. And an example would be when she needed transportation, but she needed like 2 people. So she'll need the driver and somebody to assist her as well. So she needed a 2-person. So I thought it was a routine transport booking. However, this particular hospital, oh no, they had a criteria. And for 45 minutes, I was on that phone. I didn't even know at first that I was going through their criteria. So they were asking me trick questions. Okay, so how then does she go shopping? Those types of questions to book patient transport. So they had a very high criteria, and I felt frustrated, but I was glad that I was able that she had asked me to do it, because I don't think even a regular English speaker would have agreed to do it, because it was tough on the phone that day. But just using family, friends, people in your neighborhood to help support you, to help support you in your health journey. So that's an example of just helping booking with patient transport. She asked me her neighbor, so you could just look a little bit closer to home for people to help you. It doesn't always have to be that you literally book an appointment, to actually get, you have to go and specifically find. You can actually look a little bit closer, but within your community. So it could be that, say if you're a Christian, you might want to speak to your priest, to help you, and perhaps if it's to read documents, say for it, you could just ask your neighbor to help you read.
Oh, this is wonderful. I'm learning so much myself from this
your sphere of influence for support.
Yeah. So I'm going to come to you again in a moment, and perhaps back to you, Adam, to kind of expand on this thing, because there's some really important points coming out about advocacy, about peer support, about communities, about inequalities. And yes, of course, I guess what we know is that many of the people, I'm guessing perhaps most of the people on this call are here and have English as a first language, probably have high degrees of health literacy. And of course, what's most important is that what I'm getting from this is to look out for my community. What can I do to support my community? So thank you for that, Curie. So any thoughts from you? And then Adam, I'm going to come to you as well.
Well,
yeah.
oh, sorry, go on, Adam.
Adam, yeah.
Please. I mean, like I thought about it from like so I never knew what a health passport was, and it seems an amazing idea. And it's like, what's everybody got in their hand? What do they know what to use? A phone, a handheld, or they've got like a tablet. And I just think, going into the future, technology, it would be like I would have really benefited from having, like my journey on a handheld handset. So I would have all my appointments and stuff, and be able to access information on, like, for example, top surgery that I had. I had not a clue. I had to go to London for it. I had to travel up and down. So talking about transport, I was nearly bankrupt after it. because I had to travel all the way down to London to get my surgery, and it's day surgery, so you're not allowed out without a chaperone. So it cost me about £500 to get a friend to come and get me. So I could have been better prepared for that. But going back to having almost that health kind of passport electronically that I would be able to take to my appointments, when I'm seeing the nurse or when I'm seeing the GP or when I'm seeing other healthcare professionals. And throughout that journey, I'm actually helping educate these health professionals as well. Because not everybody knows everything, do they? Sort of thing.
Not at all. Not at all. No. Just tell us a bit more about the health passport. What is it, Adam? Where do you get them from? How do you
I
use them?
don't. Yeah, I kind of came across it because I volunteer in a mental health recovery college in Newcastle, which is fantastic. It's really helped me. And it's just another way to advocate yourself to the GP instead of having to tell your story again and again. What's your life story? It can be really exhausting. And sometimes you really, like I say, when I get anxious and stuff, I can't really articulate myself when I need to. And it's just got all your information on it. What your condition is, maybe your medication, important information that you can pass over to the GP so they can actually read and get up to speed. And so it creates you're going to the appointment, and that appointment's not being wasted because you're trying to articulate yourself, because the information that they need is there, it's written down.
Yeah.
Yeah. And it is so much easier, you understand what I mean, to be able to advocate. Yeah.
Completely. And what I've got in the chat is that Deborah Dulake is saying in Nottinghamshire we have the About Me form. So the About Me form sounds like a health passport. And thank you, Deborah. You've helpfully put a link in the chat, which is brilliant, absolutely brilliant. There's also people talk about one-page profiles, which again it's about me. It's about the way I like to communicate. It's about my preferences. If anybody else has got any good ideas of health passport approaches, please put them in the chat.
I think
Sarah,
it's fantastic.
sorry,
You don't
Adam,
have
yes.
to, sorry. I just think it's fantastic. You don't have to worry about going to appointments thinking, oh my God, my head's like da da da. Your health passport's there. You pick it up, take it to the appointment, and it saves you giving it song and verse, and you're getting your needs met within that appointment time as well. Because the amount of times I've been in an appointment and it's like the last minute I've actually got what I've wanted to say to this GP.
Yeah.
And then it's, you got what, 8 minutes then?
Yeah, really important point. Sarah.
I think what you've been saying about whether it's called a health passport or About Me, or there's lots of different terms for this. I think if someone comes to an appointment with that, a GP or whatever healthcare professional it is, I don't think they can kind of say computer says no, which is a lot of what is coming up in the chat. So I've been skimming the Q&A, I've been skimming the chat, and I just thought this ties in quite nicely. Lots of people are asking, but what happens if you come prepared? Even though you are the expert, what happens if they say, well, actually, I'm the expert, I'm the healthcare professional, I'm going to tell you what to do. So I'm kind of turning it around a little bit and turning it into a question that I've seen. Although I feel like I've kind of answered it because the patient is the expert. So they're coming with all the proof to the healthcare professional. But I'll put it back to you, Curie and Adam. What if you come to an appointment with all this information and they say, well, no, actually, I'm the expert, computer says no?
Well, what I would suggest is asking for a second opinion and a third if you have to. So that means you will ask your consultant or your GP to refer you to another doctor it's called a second opinion. So another doctor or consultant will look at your health journey or your health issues, your symptoms, or whatever you're requesting for, and provide consultation on that as well. So it could be in your favor, it may not be in your favor, but you can still ask for another if you're not satisfied. So what really should happen is that at the second opinion, they'll make a decision as well, but they'll also give you the reasons why. And you can ask for it. You can, if you have a particular consultant in mind, you can name that consultant and you'll be referred. So you also have that flexibility as well to choose who you would like to have the second or even third opinion. And they'll all give their reasons as well. So that helps. So you shouldn't feel as if you have no option. That's the only hope, because it's your body. And if your gut instinct is saying no to this particular treatment or no to this particular medication, and the doctor feels that in the best interest, or as far as the knowledge he knows, this is the solution, be free to ask for a second opinion in another hospital, even in another part of the country. Thank you.
Thank you, Curie. And Adam, I'm going to come to you in a moment. I'm doing what most men can't do, which is to both listen and look at the Q&A at the same time. And thank you to everybody who's putting some ideas on the Q&A. There's a few really good web links there. Vivian Warren has put a web link with regard to passports, health passports. Anthony Atherton, you've written a lot about UCPs. Anthony, I just wonder if you could say what a UCP is in the chat rather than verbally. That would be really, really helpful. But I'm just going to come to you now, Adam, for thoughts about what if the healthcare professional says, well, do you know what, I'm the expert, or words to that effect. So actually what you're saying doesn't really matter, or words to that effect. What's your response to that?
Yeah, but using my own experience when my testosterone got stopped, and I was so frustrated, and I complained, and I got a call from the GP, is it the managers, and she was actually really, really dismissive and rude, and it was really upsetting because I thought to myself, where do I go with this? I need my testosterone. And it was really frustrating, and I just had to change to another GP surgery. And I often speak to other trans people, and it's the same with them. They're like, that's not a good GP surgery. Where's the GP surgery that's trans friendly, and it shouldn't be like that, but needs must. But now, feeling more empowered and informed, I would be more confident to be able to challenge the GP in the sense of, well, hold on, like, I know that you respectively, I wouldn't swear or raise my voice and stuff and whatnot, but I would certainly be more wanting to challenge the way they were towards me, and probably seek advice, as opposed to walking away. Like at the beginning of my journey, and it's like, I really want testosterone, I really want my top surgery. You're just feeling desperate. You're almost like every appointment, you're like your cap in your hand, and you're just like, you're too scared to question, you're too scared to challenge back. You understand what I mean? And it's like, I'm a far cry to the way I used to be. In that case, yeah.
Yeah, that's so clear. It's interesting, there's been some recent research demonstrating that probably in about a third of consultations, we're not as patients asked about what's most important to us. And as a result, about 2/3 of patients are given advice that we as patients can't or won't follow because it just doesn't fit with our lives, our preferences, our values, our goals. About 2/3.
I just add? Can I just add?
Please do, yeah.
I actually am a PC Pie, and I'm aware there's a few PC Pies in today. Hello, that patient care and public involvement in Sunderland University has completely opened my eyes and give me such an insight into the healthcare professionals and the training that they go through. And it's helped me kind of understand my GP a lot more, understand my nurse a lot more, and what they have to go through their training, what service they're providing me. And so it's helped me to engage better with them. I've got a really good relationship with my surgery, and I would say, to anybody, get to know your surgery, get to know the people at the front desk, get to know your nurse, you know, on a human level, because we're all humans at the end of the day. It's the wee kind of things like that, you know.
Knowing a bit more about each other feels really important, actually. So we're coming towards an end now, and I just wonder, I'm going to invite everyone, but I'm particularly going to invite our panelists to just think about what's been most impactful for you today. What's the kind of message that you're going away with today from this webinar? So I'm just going to invite everyone in a kind of 20 seconds of quiet contemplation on the webinar to really focus on that. I'm going to do it myself, and then I'm going to invite each of us to just share what's been most impactful for us. Silence. We should use silences more, shouldn't we? So, Curie, maybe I could come to you. What's been most impactful for you today about this webinar?
For me, it's the opportunity to speak. It's an opportunity today to, funny enough, it's a little bit nostalgic because I've had to remember my actual experiences of my health journey. And I think just knowing that today I've been able to give some patients hope, and that there are solutions, and that they know what they know their bodies best. They know where the shoe pinches, you know. And I think that hopefully the healthcare practitioners on this webinar will also understand that it's okay to listen to the voices of their patients, you know, and there's nothing to worry about if we've done our own research as well. And that's actually nice, because within the 10 minutes that they will have to see GPs, their patients are actually mindful of this and they've come prepared, you know, so that those 10 minutes will be adequately used to the best of both people, of both patient and practitioner, you know. It helps when we are prepared. I think it helps both ways, us, the patient, and the healthcare practitioners as well, when we come prepared.
You're on mute, yeah.
Makes for really efficient conversations, right? I love your phrase, where the shoe pinches. Oh, goodness. Thank you, Curie. Adam.
Pretty much the same. Today, I come from a place where I've never had a voice. I've never been able to have a voice or a platform. And I'm able to share my lived experience, good, the bad, the ugly, in which to help educate other health professionals about the things that maybe doesn't get spoken about, and being part of the solution and not the problem. And that's my whole kind of ethos of me, being part of the solution and not the problem. Because we could just sit and stew and not talk about it. It's not going to make any difference. Having a voice is important, and speaking out and sharing my lived experience, because there's always someone listening that needs to listen and hear what you're saying and can take strength from that. So yeah.
Beautiful, beautiful. Curie, Adam, as always, whenever I sit and listen to people we call patients, I always learn. And I learned a lot from you both this morning. Takeaway from me is the power of peer support and advocacy, and what we can do in our own communities. But Sarah, maybe some reflections, and I can hand over to you to wind up today's session. Is that okay?
Of course it is. This sounds like I'm just copying what everyone else has said, but I promise that I thought about this before everyone spoke. I think the things that have come out for me is that actually the healthcare professional isn't always the expert. You know, there's been lots of examples here where you've gone to the healthcare professional with all the information, they said no, but actually your outcome was better. And then the other thing was, which really does look like I'm copying you, Adam, is that because you've been prepared for appointments and you've learned so much about yourself, then actually you can get involved in engagement activities such as today and talk about your experience and get other people involved. And you know, hopefully other patients will know that they can speak about their experiences on webinars, in engagement activities, whatever that might be, or just with their healthcare professional, and understand that they have a little bit more confidence and they do know that they are the expert in their own condition and themselves.
Thank you, Sarah. And can you just remind people where we can all go to look at the information that the
Yes, of course. So that is on our website. We've got the resource and the animation. One of my lovely colleagues can put a link in the chat for everyone. And we've got 2 more minutes. So if we put up the slides and then we can just say a few more words and come to the end. That was quite good timing, Alf, wasn't it? Well done. What perfect sharing.
So thank you for attending. Well, I'm not going to read that out verbatim. That's I'll leave that to you to read. It's 9:58. The sun still hasn't come out here in Somerset. I hope the sun's come out for you by now, but if not, we are into spring. Thank you for attending this morning. Thank you for your participation. Again, big thanks to Curie and Adam, but also to the Patients Association for this fascinating session. I hope you've enjoyed it, and please do enjoy the rest of your days.